there are certain times of the year, especially when you're seasonal calving or anything like that, that certain pressures can come on, and we have two excellent speakers today. Dr. Paula Carroll beside me is a specialist in health promotion with a keen interest in men's health, facilitation skills and developing emotional intelligence, as well as being a dairy farmer. I'll go first with Paula.
Thanks a million. It's lovely to be here. It's my first time at the Positive Dairy Farmers, and it's very, very much so been a positive experience from me. As Gillian said, I've been working in the area of men's health now for about the last 20 years, and it has coincided with meeting my husband, who's a dairy farmer. So I have been actively involved, and now work 50% off farm and 50% on farm on our dairy farm in Kildare. And as I said, I've been working in men's health for quite a while, but in the last 5 or 6 years, I suppose my two worlds have really come together. I've started to do an awful lot more work looking at farmers' health. I'm going to say a little bit about why that is in a moment. But as Gillian said, you know, there is no farm industry, there is no farm profitability if the farmer is not capable of running that business. So therefore, the health, her or his health, is absolutely essential to running any kind of business, profitable or otherwise. And I suppose I absolutely loved what Paul Bird said earlier this morning about, I suppose, assessing risk. And the second point he put up on his slide was, you know, one of the biggest risks you can actually take affecting the profitability of your farm is neglecting your health. So I suppose what I'd like to do today is speak to, I suppose, why there's a need for a focus on farmers' health, what initiatives are out there to support you around your health, but also some strategies that you could look at to improve your health. I'm not here with a load of answers for you. I'm not here to tell you how to live your lives, but I have got some offerings that you might find useful to support you in your life. And I'm going to ask you some questions. Just to reflect on. I don't expect answers from the audience as I go through, and hopefully in doing so, some answers might come for you. And the first question that I'd like to ask you, I was prompted by Paul this morning, is, are you aware of what risk you're bringing to your business due to your current health status? So what is the risk of your current health status? Paul said that knowledge is an inch wide and a mile deep. What knowledge do you currently possess about your health status? Are you on the thin wire? Are you on that rickety path? Or are you on firm ground? I was delighted to hear that Tom and Moya take themselves every 3 years to get a health checkup, because that's where you're going to get knowledge about your health. If you don't have it at this moment, irrespective of your age, I would say that would be a very good starting point for you. Okay, so I'm going to start a little bit on the why focus on farmers' health. In this particular slide, we look at all professions in Ireland, and this is the mortality rate. As you can see here, if my pointer is, oh, excuse me, sorry. If you're a farmer or an agricultural worker, you are 5 to 7 times more likely to die of all causes of death than a salaried worker in Ireland. 5 to 7 times. We're used to hearing that the farm is the most dangerous workplace in Ireland, so we would expect that some of these deaths are going to be due to injuries and accidents. But actually, the majority are due to cardiovascular diseases and cancers. So have a look at the ratios there. You know, if you're an employee or a manager, you're 3 times less likely to get cancer and die from cancer in this country than if you're a farmer. Likewise, if we were to look at employers and managers, we're nearly 5 times less likely to die from circulatory disease. So for me personally, this begs another question. What is it about the culture, the environment, the behaviours on Irish farms that predispose farmers to this death rate in comparison to other members of the population? And it is one worth considering. Because if we even look at this data from 2000 to 2006, for each of these causes of death, for farmers and agricultural workers, the situation is actually only getting worse. So there is a trend here that across these ages, this time frame, the incidence for farmers increased by 38% across 6 years and 29% for agricultural workers. I understand that there's a genetic predisposition to these particular conditions, but as others have said here today, particularly cardiovascular disease, there are modifiable risk factors that account for about 70% of the prevalence that we're looking at here. So there is definitely something we can do to prevent these conditions, but it does ask us to examine what is it about the culture, the environment, and the behaviours on Irish farms that predispose farmers in this country to premature mortality at much higher rates than other citizens in this country. So I'm absolutely delighted that there is a health session at this conference, because it is something that really, really does need to be looked at and has become the focus of policy in the Department of Health, the Department of Agriculture, and in Teagasc, and I'll say a little bit about that in a moment. I absolutely love this quote by Michael Harding, because I actually think it says an awful lot and can tell us a lot about what's happening. I thought he was going to say more, but he didn't. He manoeuvred himself nimbly across the ditch and walked away into his fields. Because like a lot of farmers who have seen their world transformed and ended up on the margins of New Ireland, he felt things deeply, but said very little. So for me, there's two pieces of this quote that I would like to bring to your attention. The truth is that the world of farming in Ireland has transformed in the last number of years and has moved from a very central role in our society to more of the margins. And the public discourse today, as we all know and we all feel, is not fantastic about our industry. And we are feeling that deeply, and too many are saying very little about it. From one farmer that we spoke to recently, he said that if you have a broken arm or a broken leg or had some sort of physical injury, everybody will be asking how you are, or how long it will be until you're off the crutches, those sorts of conversations. But when there's a battle going on between your two ears, we don't seem to do as much talking about it. And this for me is an absolutely tragic statistic. That in the last 6 or so years in Ireland, we've had a higher mortality rate on Irish farms from suicide than from farm accidents. And I just need to pause there for a moment, because I think there's many of us in this room who know somebody in our community or know the family that have experienced this. So I think it's really important we start this conversation. There are certain things outside of our control, and there are things that we can control that I think we need to start bringing into our conversations. So I want to talk a little bit about stress, because it's highly prevalent in the farming community. A recent survey showed that 57% of farmers identified that they were highly stressed in the last month of their work. It was higher amongst dairy farmers, up to 76%. As I said, I've been working in this field for a long time with men's health. I have worked with groups of men, and we have collected objective data that have told us that they are at a very high cardiovascular risk. And yet when we ask them to tell us how they rate their health, they always say very good or excellent. I absolutely love the optimism of working with men. I love it. And that is why I do not believe that only 76% of dairy farmers are experiencing stress. They're the ones who are telling us that they're experiencing stress. I also believe that some farmers don't know how to recognize their symptoms of stress, and therefore don't even know that they are acting from a stressful place and working Stress is not all bad. We do need stress to motivate us, okay? It is a state of worry or mental tension that's caused by a difficult situation. It's a natural human response that prompts us to address challenges and threats in our lives, and everybody experiences it to some degree. The way we respond to stress, however, makes a big difference to our overall well-being. And I really would like to hear you say that we respond or we react. We very often react in our lives through habitual behaviours. And if we can bring it into our awareness that we may actually be stressed, we may be in a position to respond in a healthier way. A student of ours recently looked at the sources of stress that are currently that Irish farmers exist. So there's obviously the socioeconomic status, there's rural isolation, but there's also something that a few have mentioned this morning around rural masculinity and values and the identity that is associated and so deeply entrenched with being a man and being a farmer in rural Ireland. And it drives things like having an unsustainable work ethic, procrastinating over health, and being stoic when it mightn't be necessarily helpful. And in our daily lives, there are some acute sources of stress, such as the machine breaks down. However, if we experience prolonged chronic stress, it can have really negative outcomes on our physical and mental health. The piece in the middle is very interesting. How do we mediate stress? What coping mechanisms might we have that we can respond with as opposed to reacting? Do we have personal resources? Do we have some mastery? Can we draw upon our self-esteem to support us, or can we access local services? As I said, in the last few years, these statistics have obviously come to the attention of the Department of Health, the Department of Ag, and there are a number of initiatives that have been happening to target and engage farmers to improve their health. Dairy Women Ireland recently had a cracking conference above in Naas, and middle of the day we had a fantastic hour around health promotion, which was wonderful. A number of farmers, I think in Tipperary, have started to Make a Move programme. You heard Anthony Betts earlier talk about the Farm Connect programme that the Men's Development Network are running, and I'm involved in this last one here. Excuse me, it keeps hopping on. This Engage programme, whereby we now have I think in the region of 200 Teagasc advisors trained up to actually begin the health conversation with farmers. And the idea is that through programs like this, we add an extra piece to this intervention where we start the conversations in the farmyard, bring them into discussion groups, and let health be part of the conversation. So my offerings for you today is, what might you be able to do to look after yourself? I accept there's so much outside the farm gate that you cannot control that will affect what's happening on your farm, from environmental policies, political decisions. But what might you have control over that you can do something about? And the big thing, as a human being that finds it very difficult to implement any kind of change in my life, is to just do something really small. I mean that sincerely. Do one thing and do it for about 2 months before you even try to do a second thing. Habits are very, very difficult to change. It takes about 3 weeks before you can even begin to embed one. They always say about the 26th of January is the time in which New Year's resolutions are overturned, because people are only starting them in the first week, and it's very, very difficult to get to the third week. So these are my offerings, and some of them have been touched upon today. I think it's absolutely critical that as human beings we are able to recognise our own symptoms of stress. As Anthony and others have said today, how incredibly important it is that we stay socially connected and make conscious efforts to do so in our lives. I'm also going to say something about the importance of eating well and sleeping. So we are very unique human beings there are a variety of symptoms of stress, from headaches to not being able to concentrate, to changes in dietary behaviour, to having sexual difficulties. And stress affects our health in a variety of ways, acutely and chronically. You know, from difficulty swallowing to dizziness to neck and back problems. The very last organ in your body that will know that you are stressed is the cognitive part of your brain. Every other part of your body will be sending you messages long before your brain kicks in. And I would encourage you to reflect and see, well, what speaks true to you? How might you be able to let yourself know a little bit earlier that you are stressed, so that you can start to engage in some of these ways to reduce your stress? And again, it's different for all of us. In all of these pages, you'll see something like talk to somebody, reach out and actually speak to somebody, or maybe ask somebody how they are, okay? Keep your mind active, have a purpose. In the interest of time, I'm going to move on and talk about the importance of staying socially connected. Would you believe that loneliness has just got its first minister in the UK? Loneliness is now identified as a social epidemic that is a major public health concern. I'm fascinated by this. One of the former chief medical officers in the States wrote an incredible book called Together that describes just how dangerous being lonely is for our health. We are primed for connection. Being lonely is equivalent to smoking about just under 15 cigarettes a day. It will predispose us to a variety of health issues, mental health, physical health issues. And we don't have to be on our own to feel lonely. We can be in this room feeling disconnected from the human beings around us. It is about the disconnection and not having our social needs met. We can be isolated and on our own and be very content. If we are socially isolated for a prolonged period of time, we're more likely to be lonely. But it is absolutely essential that we allow ourselves to connect, not just be in the company of, but actually connect with other human beings. It is really, really important for us to do that. How can you do this? You know, others spoke about it today. Take up a hobby. Don't wait till you retire. Join a group, volunteer. I found myself at a strategic development program a few years ago, and a farming couple came in to talk to us. And the farmer spoke of this third space, which for me personally was a revelation. You know, I have an off-farm job, I have an on-farm job, and I have a house with 3 kids. You know, I absolutely could, you know, spend all of my time doing all of that, but he talked about the value of this third space, and personally, it's got me out into my community. It's got me speaking with people who know absolutely nothing about farming, and I connect in different ways with people. So again, these are the offerings. What might work for you? Eating well. It is so easy when we're so busy to get something on the run. It's become a part of our culture, and yeah, we fuel and do whatever we need to do in the moment. There isn't a hope that we would be as flippant with the dietary needs of our herd, because we are so aware that you put this amount in, we get the white gold out, and we have a profitable farm. And yet, for so many of us, our own diet is secondary. It's what we can manage at a time. So just a couple of things that I'd like to say here, particularly for men. There is this absolute myth that I would love to dispel, that you can only have a healthy diet if you eat small portions of tasteless foods. You can absolutely eat really nutritious, large volumes of food and be sustained. But it is really, really essential to eat well in order to maintain your strength, virility, stamina, and vitality for living. It is what fuels us. And here are just some tips of things that you could possibly do. Any one of them, as I said, one small change is all you need. The one I happen to love from this is if you can just eat a piece of fruit or a piece of vegetable with every meal. You know, you'll get there to your 5 a day. And my last piece for you is the importance of sleep. I think it's completely misunderstood. Hitler used sleep deprivation as a form of torture. If we experience chronic sleep deprivation, and I'm really conscious you're coming into spring calving, and as the weeks go on, the deprivation can increase. We will make poor choices. We will, with respect to all lifestyle behaviours, but also we are more prone to accidents on the farm. But actually, poor sleep quality is really associated with mortality and cardiovascular disease. Insufficient sleep results in developing of plaque in our neurons and brings early Alzheimer's. It's also related to diabetes, cancer, and being overweight and obese. It's absolutely critical that we get a sufficient volume of sleep. And I think it's worth considering how you're going to build some sleep into your lifestyle over the next number of weeks. Again, here's just a few tips about sleep hygiene. It's become quite an industry. It talks about the importance of having a routine. It talks about not eating too soon before you go to bed. Turning off electronic devices and that blue screen at least an hour before you go to sleep. Engaging in some activity, which you're probably going to be tired getting to bed anyway after the calving, but creating a healthy sleep environment. So, as I finish and hand you over to Will, I'm just going to ask you to look at what I've been looking at all day, which is the motto for this particular conference. So it's like, you know, better farming, better business, better lifestyle. And Paul Bird talked this morning about Charlie Munger and inverting things, and I absolutely am a massive fan of Charlie Munger and Warren Buffett. And I really think this needs to be inverted. The better lifestyle underpins the better farming, which ultimately underpins your better business. And I would encourage you, whatever works for you with respect to your own health, give it a go and do your best and just let the rest go. Don't focus on the outcome. Don't say, I'm going to do this because it's going to give me that outcome. Just focus on the one change that you might choose to make and be kind to yourself. And if it doesn't work out today and you don't do it, fair enough, give it a go again tomorrow. Thank you very much for listening.